I had the privilege of working in Nigeria with WHO from the middle of August for a month. As Margaret said, the call came out at the end of July. I thought I'd be sent to Sierra Leone, but on the 20th of July, a Liberian-American person landed in Lagos. His name and everything about him is in the public domain. I won't go into that, but he landed in Lagos airport. He was sick in the airport. He was driven to a private hospital where he denied contact with anybody with Ebola. He was tested as though he might have had it anyway. 2 days later, the result came back. He had Ebola. Nigeria alerted that there was a case of Ebola, and things took off. So basically, for those of you who don't know, Nigeria is the most populous country in Africa. There's nearly 200 million people. Lagos is the biggest city, has up to 20 million people, and the outbreak spread in Nigeria from Lagos to Port Harcourt, which is the city that's the centre of the oil industry. So a statement was made by the American Consul General that the words Ebola and Lagos sounded like disaster, especially in the context of what had happened or what was seen to be happening in Monrovia. Nigeria is an incredible country. It's got enormous wealth, and it's also got enormous poverty. So you've got slums, you've got wealth, you've got diamonds, you've got incredible roads, you've got masses of people, enormous issues with traffic, people everywhere. So you have this infectious disease, and we have to control it. So back to what David said, it's about breaking the chain of transmission. And David talked about how we're now talking about human-to-human transmission and the ways in which it's spread. So the Nigerian Ministry of Health, the Federal Ministry of Health, immediately put in place an incident management team. And this is basically what's involved. And this is the partnership that's in this. This is all the different dimensions of what goes on in the outbreak and all of the bits and pieces that go with it. All of them are interconnected. So you've got, Margaret's talked about the case management, the sick people, and all the things that go with that, from the evacuation of sick people to the decontamination of the place they've been in, to all the water and sanitation things that go with that, to the issues around the borders, the point of entry, mass gatherings, to the issues of epidemiology and surveillance and contact tracing, and all of the things around communication and social mobilisation, and the overall linkage of all of that. So this is the description of the incident management team that's been published by CDC recently, led by Dr. Faisal Schwab, who was the head of the polio incident management team, so had experience of managing a huge outbreak. So these groups met in the EOC, the Emergency Operations Centre, all day, every day, 7:30 till 10:30, 11:30 at night. They've slowed down recently, as you probably know. There's an action tracker every day. Every group reports on everything they're doing. So Nigeria has shown the world how to do it, basically. The partners, it starts with the Federal Ministry of Health with the Nigerian Centre for Disease Control, and there's a Nigerian Field Epidemiology and Laboratory Training Programme, so there were people in that who were able to be mobilised immediately. It started in Lagos State, so Lagos State Ministry of Health was organising it to start, and when it moved to Port Harcourt, that's River State, that state became involved. Then you had WHO, UNICEF and MSF. And MSF have been the organisation that have been dealing with Ebola for 30 years. They know how to manage treatment centres, they know how to do contact tracing, they know how to do disposal of bodies, they know how to do communication. The MSF team in Nigeria was from MSF Spain, included an anthropologist. They know how to do this. They're fantastic. CDC from Atlanta are there as well, and a range of other organisations, including eHealth Africa, and I'll show you some of the things that they did. And the really impressive thing was the thousands of people who came forward to volunteer, and hundreds of people who work with the EOC, who are volunteers, who come forward to engage in this for Nigeria. So David showed this already about contact tracing. So basically it's about finding the case, finding a contact of somebody who could become a case, identifying somebody who, watching people for 21 days and then they're clear, and then the missed contact, the person who could spread to other contacts. So what happened this is the outbreak in Nigeria, it's 20 people. The first, number one there is the person who arrived from Liberia. If there's a red circle around them, they died. The people who are shaded in blue are healthcare workers, and I'll come back to talk about them. Number 6 is a contact who disappeared early on. He went to Port Harcourt, and the healthcare worker who looked after him then died. He passed it on to another person who died. So you have this network of transmission. So the numbers from Nigeria, it's 20 cases, 19 of them confirmed, of whom 8 died. 11 of them were healthcare workers, 9 of whom acquired the infection in that 48 hours after that person arrived in the facility before the diagnosis was made. 5 of those healthcare workers died. 898 contacts were identified, and there was thousands of face-to-face visits because they're seen every day for 21 days. And then the community mobilisation group, a pin is dropped on the home of a case or a contact, and depending on the level of contact and the density of the population, it's either 500 metres, a metre, or 2 kilometre, or 2 kilometres, and every household is visited. And I'll show you some of the stuff that goes on there. The eHealth Africa facilitated the use of smartphones, so all of this data was collected by smartphone and centralised in the EOC. There are huge issues of stigma, as Margaret said, and family, the cases themselves, people who've been discharged need to get Ebola-free certificates to go back to work. There's all sorts of issues about people being terrified of being near anybody who's had Ebola or being near a family of somebody who's had Ebola. Some of the other communications issues in Nigeria, this was a disease of middle-class and well-off people to start with. It didn't become a disease of people in slums and of poor people, so the website was hugely important. It had millions of hits. There are 33 million people on Facebook in Nigeria. There's 20 million people use Twitter, so Facebook and Twitter were huge. Public information campaigns about what Ebola is real, it's not dangerous, you can protect yourself, you don't have to be terrified of it. Those messages were got out very, very strongly. The social mobilisers went house to house, as I said, informing people and generally talking about Ebola in general, but also about protecting yourself from infection. So they would demonstrate hand washing and get someone in the house to demonstrate hand washing back. Children in Nigeria, there's a huge UNICEF campaign on hand washing, so children can demonstrate how to wash your hands really, really well. The media has a huge role in this, and as we've seen around the world, like you see what happens in the US and in the UK, every bit of information about every case and information about every contact gets into the media. There are some rumours that need to be dispelled. We're seeing rumours in this country even now, but in Nigeria there were issues about cola being good, that salt was good for you. These had to be countered. Nollywood rode in big time. A range of Nollywood is the 3rd biggest film industry in the world, so Nollywood stars, models, pop stars, the lot came together. They've made a lot of videos, radio skits, radio shorts, pieces for buses and all sorts of things around hand washing primarily, and about keeping your distance from anybody that would have Ebola. The role of the churches is huge. Many people in Nigeria go for different kinds of faith healing, and there's a lot of laying on of hands of people who are sick. 2 of those contacts had up to two of those people who had Ebola in Nigeria had up to 200 contacts, many of whom were people who would have laid hands on them in religious ceremonies. So there's all kinds of cultural issues in this. There's one textbook on the anthropology of Ebola, which is based on incidents in Congo and Uganda. It's out of print at the moment, but there's so many cultural dimensions to this that we need to look even in this country about the way we behave and the way our culture is enabling us to respond. Like, we're definitely closer to Boston than Berlin in the way we're responding to it. I mentioned points of entry, the whole thing around people moving from West Africa and the issues around screening at exit from airports, and the issues then about entry screening, which is something that, in this country there's still questions about whether we should be entry screening. Anyway, the good news in all of this is that Nigeria was declared Ebola-free on the 20th of October. There was 2 incubation periods, 42 days after the last confirmed case. These are 3 of the doctors who had Ebola, who managed that first person at the very beginning, showing how they were managed with oral rehydration. They didn't need elaborate, they didn't have blood transfusion and all that sort of thing. They were identified early and were managed with oral rehydration. And this is showing the amount of oral rehydration that they had that got them over it. And the message is that this is treatable if it's got early.